I was given the task of finding out what's new in medical oncology with respect to elderly patient population, and that is a hard task in a way, because if you look at the publications made over the past year, the most recent publications, they tend to be general publications, and you really have to sort of dig the information concerning elderly population from that data. You don't actually have that many publications that are solely in elderly population. Well, this also comes from general studies, general research trials, including all ages, and there is simply no data that would be coming out from directed studies to elderly patients. So, for example, the renal carcinoma material that I presented, that is exactly this type. I think the major problem is that we really do not have proper data with respect to aging people. Of course, in oncology we treat mainly elderly people, of course, because cancer itself is more, there is more cancer in over 65 years old, so it's a kind of a familiar population, but we still lack data on much older people, like 75-year-old or even 80-year-old people who we treat today. And we have to base the treatment on facts that we get from research done on younger people. And that's a major problem, because definitely a 75-year-old or 80-year-old is different from a 60-year-old. Well, this is typically thought in the field that you should look at the age, the calendar age, and I think that's a mistake. Of course, everybody knows that there are very fit 80-year-olds and very frail 60-year-olds, and you should not look at the calendar age only. There are methods of selecting patients for even toxic treatments by using these assessment methods that we have now in geriatric oncology. With respect to targeted therapies, it has changed a lot in oncology, but I have to say that unfortunately the same problem which was there like 2-3 decades ago, i.e. the lack of information or lack of data with respect to elderly population, that's still there. The problem is that there is no financing for doing randomized controlled trials in a certain high-age population. The commercial industry is not interested in doing that sort of trials, and getting money from non-commercial sources is difficult. But still, as a society, I think SIOG should try to initiate trials like that. Performance status alone or calendar age alone is not enough to evaluate how fit the patient is for cancer treatment. You should apply some sort of a general geriatric assessment modality before deciding whether to treat or not. Well, in this again, because of lack of data in a certain aged population, we have to rely on what has been published in the total oncology population with respect to this cancer type that is in question. They should treat them, yes, but before making decision on the treatment, evaluate not only with calendar age, not only with performance score, just look at some sort of a geriatric assessment before you do the decision. There are several of those validated modalities that you can apply.